This is Recife. Welcome to Recife, the vibrant capital of Pernambuco and one of Brazil's most interesting cities. Situated along the northeastern coast, Recife has countless differences where the beauty of nature touches city style. Recife means reef in Portuguese, which is due to the giant reef which lays along the coast. This city has a lot to offer. Flavors in their markets, the streets buzzing with traditional music. Founded in 1537 and is home to 3.7 million people in its metro area. Every corner of the street tells a story. Recife is more than just a place, it's an experience. Culture pulsates in every dance, in every dish, and in the smiles of the amazing people. This is also Recife. In the world, the contrast between rich and poor is immense, and it's only growing. Nowhere is this more evident than in Brazil, where the wealthiest live right next to those struggling to survive without even basic documents like a CPF. The stark contrast is also visible in Brazil's healthcare system. Brazil has a universal healthcare system called SUS, designed to provide healthcare for all citizens.
My name is Arthur. I'm a resident of pediatrics here in MGH, Brazil. Here in Brazil, we have like our universal health system that we call SUS. Is a short term for Sistema Universal de Saúde. It's a system that was based in the England and the Canadian, the English and the Canadian kind of health system, but we like try to adapt to our reality. So here in EP, we don't ask for any payment, any kind of payment. Our funding is all public funding, so the patients can come over here and anytime and any moment of the day they will be seen, they will be examined, and if needed they will be hospitalized, and all the treatment will be offered for free, and we really don't ask any in return of the patients.
Brazil developed the unified health system, SUS, to make healthcare accessible to everyone, regardless of socioeconomic status. While SUS strives to ensure universal care, stark differences persist between public and private healthcare facilities. Around 70% of the population uses SUS, the public healthcare system. This means that the majority of Brazilian citizens rely on public hospitals for medical care. One of those public hospitals is IMIP, a beacon of dedication in Pernambuco, serving thousands of patients daily. Despite limited resources and crowded facilities, the workers at IMIP demonstrate extraordinary commitment, providing welcoming care with compassion, innovation, and resilience. IMIP was established in 1960 under the name Instituto de Medicina Infantil de Pernambuco. Later it expanded and changed its name to Instituto Maternal Infantil de Pernambuco.
Public hospital. We receive patients for all the health system. So in the beginning, IMIP was more directed to the pediatric age patients, but now we are more involve all of the ages. Now we have like a hospital that intervene in all kind of aspects of the health system needs. So we have now internal medicine nurseries, we have pediatrics, we have surgery. So we are a very big hospital, and we get a lot of the needs of the population here in the Pernambuco state and of the northeast of the country as well.
In contrast, private clinics offer faster services and cutting-edge facilities, but remain accessible only to those who can afford them. There are also downsides to the private system, like overdiagnosis.
Hi, my name is Regina. I'm a fifth year medical student at the Federal University of Pernambuco. When we go to the private healthcare system, that's reserved for the very small portion of the population that we have with good income that can pay public public healthcare and that can private healthcare and that can pay health insurance. Those people go to the private healthcare and they are sometimes the ones that say what they want and they get what they want. So they're paying that certain doctor will want to give them the, I don't know, like the MRI that they want and think they need because they are the ones paying, and becomes like a relationship of clientele, and that relationship jeopardize the treatment of the patient can be iatrogenic because the examination, the use of imaging exams and laboratory exams that aren't related to the clinic aspects of that patient can lead to iatrogenic conducts such as overtreatment and the emotional aspects of finding out something that you didn't need to at the time. One thing that is a very big topic here right now is the screening for prostate cancer.
For example, research indicates that advanced diagnostic tools used frequently in private clinics contribute to the overdiagnosis of conditions such as breast cancer through mammograms or prostate cancer via PSA tests. While early detection is vital in some cases, overtreatment of harmless conditions can cause more harm than good. The World Health Organization highlights overdiagnosis as a global issue, particularly in healthcare systems influenced by market forces, like Brazil's private sector. This practice can lead to unnecessary interventions that not only pose risk to patients, but also strain healthcare resources. In a country marked by profound social and economic inequalities, healthcare in Brazil transcends the boundaries of medicine. It involves understanding the patient's lived reality and addressing their needs within a broader social context, and in this way addressing the social barriers that prevent patients from receiving care. For many, the journey to treatment isn't just about visiting a clinic. It involves overcoming financial, educational, and logistical obstacles. This approach is something Brazilian healthcare workers exemplify every day. They have adopted a patient-centered approach that emphasizes understanding a patient's social context, blending skill with empathy to bridge the gaps in a divided healthcare system.
So um, we have something when we look at a patient and we try to put them into context. We can look at the three delays. We have education. Education can come as a delay at several forms. Lack of education can lead to not recognizing a problem and not looking for healthcare at time. Lack of education can lead to certain fanatic beliefs that will keep you from looking for good medical decisions, such as um, being against contraception or the anti-vax movement. It's all based upon lack of education. Lack of education also impacts higher levels of our country because um, when it comes to a democracy and electing someone to represent us in the Congress, we will elect those who we think are looking for our best interest. And if we think that our best interest is something um, that's not based on knowledge, only based on the speech of that person. We are vulnerable to whatever they want, whatever they think we need, and it can be based on ideology over based on evidence. So
In Brazil, education plays a critical role in healthcare access, particularly in poorer areas. Limited health knowledge often means people are unaware of health issues until they become severe, therefore delaying critical treatment. Studies show that individuals with less education are less likely to seek medical help promptly, exacerbating health disparities and outcomes. Research confirms that health education can bridge this gap, improving public health outcomes by encouraging preventive care and timely medical action.
lack of education can lead on delays in treatment, as we had in the COVID pandemic, where we had delays in lockdown, we had delays in searching for a vaccine and distributing the vaccine, because we had representation that didn't believe in the pandemic, that didn't believe in vaccination, and all that led to influence in the people who isn't educated.
While the country was praised for rolling out vaccines quickly, people in rural and poor areas had much lower vaccination rates than in cities. Many rural communities did not have enough vaccination centers, healthcare services, or good information about the vaccines. By 2021, even though 70% of Brazilians had gotten at least one vaccine dose, fewer people in the rural north had been vaccinated.
The other delay is transportation. We have a very big country, and the population of our country is mainly on the coast and the countryside. The interior of our country is lacking on uh, healthcare, it's lacking on hospitals, it's lacking on um, capacitated people to attend to those people's problems.
Transportation also plays a huge role. Take Pernambuco, for example. Here, the scarcity of healthcare facilities forces many to travel long distances to reach the nearest clinic or hospital. But for the 11% of Brazilians who face geographic barriers to care, the problem goes beyond distance. It's about accessibility. Limited infrastructure combined with unreliable or non existent transportation makes accessing healthcare a discouraging challenge in remote areas.
So some places are for like 3 hours away by car to the nearest hospital. And those people who live 3 hours away from the hospital, they don't have the money to travel 3 hours easily to the hospital. So they tend to seek for help when they are in desperate need. They tend to seek for help at a great amount of cost, and sometimes in not a timely manner. So transportation is a big problem because of the size of the country, the road plan, and the distribution of hospitals. So there we have the third delay, which is the quality of the healthcare and medical assistance, which is to prevent the iatrogenic behavior, which we call the fourth uh, prophylaxis here. The first one would be for the patient who doesn't have the disease. The second one to prevent complications from the disease. The third one to prevent death by the disease, and the fourth one to prevent iatrogenic behavior. But when you go to the doctor, you're going to someone who has the strength of speech because they've studied for it. So people will believe what you're saying. And that's something that the patient is completely vulnerable to.
Patient centered care is critical, especially in a country with such vast socioeconomic disparities. But what does it mean?
I was a student that were responsible like for a community that was very humble, and I had like a newborn that the mother was drug addict, and she didn't like breastfeed because she used like drugs and heavy drugs, and this child had a very inadequate diet with milk that is not adequate to the age. So she had like diarrhea with bleeding, and she was very dehydrated.
In this case, Arthur could have just treated the diarrhea if he didn't know about the social problems of the family. But that wouldn't have solved the problem, because the real problem was that the mother wasn't able to breastfeed the baby.
So we have a lot of problems. Sometimes the patient is only hospitalized because social problems, because they don't have any money to get out.
So this is a great example of what patient-centered care is.
It's the sickness of our society. We live in a society that is sick because of this inequity. So this is related with the process of health and sickness of our patients.
Under patient-centered care, care focuses more on the patient's problem than on the diagnosis.
We have many women that suffered sexual abuse. And when they came here, they don't say, I was abused. They don't say, oh, my father, my child is died. They come with symptoms. So they say, I can't sleep, or I have a stomachache, or I have a headache. And if I prescribe a medication, and it's so easy to prescribe the right drug and give to them, but this is so few when they need so much, right? And so we need to know the social context to help them to identify the reason why they are getting sick, the reason why they have headache, the reason why they can't sleep, and help them to resolve this problem. We know that we can do much more than only look to the sickness, to the symptom. We need to see the person. In our residence of family medicine, we train our residents to use the centered person method, clinical method, and I think that's made all difference for people that we are taking care of.
When prescribing medication, doctors in Brazil consider key factors. Can the patient afford treatment? What barriers prevented their appointment? Do they lack necessary paperwork? These questions are crucial in a country where 6.6% of adults are illiterate and many struggle with health-related information. To address these challenges, Brazil trains healthcare professionals to look beyond symptoms. Medical students interact with patients early in their training, often working in communities to understand each patient's unique circumstances. This approach isn't just about treating illness, it's about building trust and fostering collaboration. By focusing on patient-centered care and health education, Brazil's healthcare system aims to break down barriers and ensure that everyone, regardless of background, has access to the care they need. The story of Brazil is a story of contrasts. It's a country where the gap between rich and poor is stark, but where compassion and innovation in healthcare shines through, bridging the divide. Understanding patients, their challenges, and their realities is what turns a health system into a lifeline. This is Recife, a city of contrasts, resilience, and hope.
Eu só te peço, meu nego.